If your eyes feel gritty or scratchy, especially when you wake up, you may be suffering from dry eyes.
If artificial tear eye drops aren't doing the trick, there is good news. Dr. Max Gomez here now with a new drug that may soothe those eyes. Doctor?
Yeah, that's right, Maurice. You know, believe it or not, dry eyes are the #1 reason people go to see an eye care professional. Dry eyes can lead to fluctuating vision, affecting everything from driving to reading. So a new drug for dry eyes is good news, and it's led to a high-profile ad campaign.
My eyes were bothering me almost every day. They were dry, they were itchy.
It's a seemingly generic informational ad. Even stars get dry eyes, and there's help for those baby blues. What's not obvious is that the ad comes from the makers of a new prescription dry eye drug called Xiidra. It's the first new drug for dry eyes since Restasis was approved 13 years ago.
It's an anti-inflammatory, so in that sense it's in the same group, but actually has a total different mechanism of action. It prevents the white blood cells from getting to the area of inflammation, which is the white part of the eye.
However it works, it's something Amy Kosoy is ready to try. She's suffered with dry eyes for years, treating it with over-the-counter drops.
Usually in the morning, and then maybe 2 or 3 times a day, and then in the evening.
So you used a lot of eye drops?
I used a lot of eye drops.
There are a number of causes for dry eyes, but it often comes down to not enough oil in a person's tears. Watery tears all by themselves evaporate very quickly. To keep the eyes moist, tears mix with an oily substance from glands in the eyelids, which slows evaporation.
Inflammation is a core to what's creating the abnormality in the ocular surface and in the tear film. So if we can cut down on the inflammation, we can improve the whole dry eye symptom.
And that's how both the prescription drops work, by cutting down on inflammation. Now, Dr. Asbill says that your first step should be those over-the-counter drops. Try different types and brands because one might work better for you than others. But if you're still having trouble, see an eye doctor to see if the new drops might help. And so far, the side effects have been pretty minimal with this, some stinging in the eyes, but that's about it. So it's a prescription, though, and it will cost you money.
Okay.
Always does.
Thank
You'll
you.
be back in our next half hour, right? There's a fertility story.
Interesting. Three different parents, DNA from 3 different parents created a new baby. It's complicated, but we'll explain it to you.
Explain it.
Wow.
Yep.
Okay.
See you in just a few.
Talk to you then. Right now.